Good afternoon. Welcome to GB News. We are the People's Channel. I'm Nana Akua. We are live on TV, online and on digital radio. Now, it's time for the Great British Debate this hour. And I'm asking, is gender neutrality the way forward? Theresa Steele alleges a private hospital refused to perform surgery on her after she requested an all-female nursing team. Now, she says that she had requested a full set of female staff after claiming a transgender nurse walked in on her during a pre-operation assessment. She says that she was set to undergo urgent bowel surgery at the private Princess Grace Hospital in London before the operation was cancelled. She says by the hospital. She said that she'd stated on admission forms that she didn't wish to use pronouns or engage with such manifestations of gender ideology during her stay. So for the Great British Debate this hour, I'm asking, is gender neutrality the way forward? And do we have to accept this as it is? So Theresa joins me live in the studio now. Well, talk to me then. So the Princess Grace, it's a hospital, it's a private hospital in London. Why did you choose to have the surgery there? Why did you choose that one?
Well, my surgeon recommended it because it had a particular set of technology. It had a double suite, it had a robot, open surgery suite, and that was why he chose it. And then when I turned up, I saw that it was a hospital that specialised in women's procedures. And I've used HCA on previous occasions, and I've always had female nurses. So it wasn't really on my radar. So when I filled in the pre-assessment form, I only asked for a single-sex room, or obviously a private room. I didn't want a gender-neutral loo, so I asked for a woman's toilet, basically. And then I said that I didn't want to as I said, engage with pronouns or such manifestations. And when I say that, I just want to be clear. This is in respect of filling in reams of paperwork about my non-existent gender identity. There's only about 2% of the population have a gender identity. I'm not one of those people, and I resent being compelled to use language that doesn't apply to me and actually hardly applies to anyone. So that's what I meant when I said I wouldn't use pronouns. But I just want to be absolutely clear that I know exactly where the line is about compelled speech, and I'm very aware that you cannot repeatedly misgender a person with a gender identity in such a way as to make them feel uncomfortable that might be tantamount to harassment. So I know exactly where that line is, and when I put that on the form, I was actually referring to my own pronouns, the filling in of the form. I actually didn't expect to see anything but female nurses, which is what I'd encountered in every single HCA hospital that I've been in. So
is there any particular reason why you only want female nurses?
Well, it's because it's a big procedure, and I would be immobilised afterwards, and it wasn't even on my radar that they would not be female nurses. I'd be immobilised, and I don't want males giving me intimate care. And I think all women, and I know there's been a lot in the press following the Daily Mail report that had the headline that I was a sex assault victim. Well, I'm not a rape victim. I've only had the sort of low to medium level of hassle, a few sexual assaults in my 20s and 30s, so I'm not claiming victimhood in that way. And I totally believe that every woman is entitled to single-sex care. You shouldn't have to claim any kind of status. You shouldn't have to say that you're the victim of a sex assault. I think it's just the civilised thing to do, and it's actually part of the fundamental standards of care of CQC under Rule 10, and they're actually meant to give it full consideration under the NHS. And when I go to a private hospital, I don't expect to have this kind of trouble that I've had.
Well, I mean, and everyone should have a choice, I suppose, in that respect. And obviously you're not saying that a man will be less able to give the care. What you're saying is that your preference is that. Now, I just want to have a chat with, stay right there, because I'm joined by transgender teacher and journalist Debbie Hayton, who joins me now. Debbie, thank you for joining me. Now, you've heard what's been said. What do you think? Do you think Theresa is making this, do you think that it's fair enough for Theresa to want this, and that she's and that she's making this a political issue by refusing to state their pronouns and gender identity, or refusing to be treated by someone who is transgender?
Well, on the subject of pronouns, I just ignore it, to be honest. And I don't have a gender identity either, even though I'm trans. So when it comes to questions on what's your gender identity, I just leave it all blank and let that go by.
So you think that what do you think of Teresa refusing to be treated by somebody who is transgender? So she's got specifics. It's quite an intimate procedure that she's having, and she's saying basically that she wants somebody who is biologically a woman to treat her in that respect.
Well, if single sex means single sex. If a hospital offers single sex care by one sex, then that should mean one sex. It should mean the female sex, and not trans women who are of the male sex. You know, that should go without saying. It's just in this situation whether the hospital felt they could provide a single sex service, a complete single sex service. And I'm not quite sure what Teresa was, what you're looking for in that, what Teresa was looking for in that situation. For intimate care, yes, sure, the hospitals should ask the patient which sex they want to be treated by. But does that go for everybody who comes into the room, the people serving the food, the people cleaning? Can a hospital provide a single sex service? Is that reasonable?
Let me just, I would like to clarify that position.
Yes, Teresa wants to clarify.
So, were it not for the patient dignity breach, where a male with a gender identity crashed my clinical pre-op assessment, I would not have had to raise the barrier to the extent that I did, because had that not happened, I simply would have requested single-sex intimate care. But because that hospital has got a problem with boundaries, and a male crossed a boundary, it was a patient dignity breach, and I was determined that he was not going to come into the room.
But that is obviously your opinion. That's your opinion, because this nurse was not going to be treating you, though.
I wanted to, but the reason that that's your opinion. No, the reason that I specified was I made an additional. I sent an email after the patient and dignity breach, and I said I complained about that, and I also said that I didn't want. I had to actually stipulate that I didn't want males coming into the room.
Yeah, well, okay. I mean,
because of what he had done.
Okay, but we don't want to go into the specifics of the case. We want to. Let me bring on Peter Tatchell onto this as well. Peter, thank you very much for joining me. Thank you very much. He's the director of the Peter Tatchell Foundation. Peter, do you think Teresa was asking too much for a single-sex accommodation by refusing to take part in pronouns and engaging in manifestations of gender ideology?
Well, I have some sympathy with Teresa, but, we all have a gender identity and we all have pronouns. I am he, him. I'm a gay man. I'm male. Teresa is apparently a woman, according to my perception. She obviously uses she and her about herself and about other women. I don't think it's a big deal to use, specify what your pronouns are. That's not a big deal to me. But what I'd like to ask is, the NHS is a highly professional body. No one can become an NHS staff member, whether it be a doctor or a nurse or anybody else, without going through rigorous qualifications and vetting. So I'm anxious that Teresa seems to be saying that somehow, NHS staff
this was a private
trans staff are potential predators.
She's talking about a private hospital. Just to clarify, it's not NHS, but it was a private hospital, just to get the facts straight. So basically what it is, in a sense, if you're paying in a private hospital, I suppose you may be able to ask for a more specific type of care. So you might be able to make those sort of things. It doesn't mean that you're being offensive to somebody who is trans. It just means that these are your requirements because you feel more comfortable. I want to bring Debbie Hayton in on this as well. Debbie.
I think Peter might be outvoted 2-1 on the gender identity. I don't have a gender identity, Peter. I really don't. I might be trans, but I don't need to. I don't need to claim a gender identity. And as for pronouns, my pronouns are I, me, and mine. And you can use whichever you prefer when you're talking to me, Peter. I really don't mind.
Yeah. So, but with regard to me, so what's your view then on, say, gender-neutral toilets, Peter? Because for me personally, I don't really like it, because I just don't like it. The seat gets left up, all the things that I don't really like about being in a male environment when it comes to that sort of personal side of things. And there's even talk about gender-neutral toilets in schools. What's your view on that?
Well, as you mentioned earlier, there are gender-neutral toilets at GB News, and I asked some of the female staff there about them, and they all said they were fine. But,
well, I don't know, they didn't. Polly is there as news reader. She says no. I said no. I've not met any of the women here at all, and I work here, who have said that they like it. And it's not an insult to the management. It's just simply that, as a preference, most women would probably choose to not have gender-neutral toilets. But what do you think about them in schools?
Those gender-neutral toilets are locked cubicles, so no one else, a man cannot come in there while a woman is in there. So it's a perfectly safe environment in that toilet. And of course, many of these toilets in the common areas have CCTV as well. I mean, the number of incidents where trans women have created a problem is almost zero. And the same with the health service and indeed private hospitals. I cannot recall any cases of NHS trans staff or private healthcare trans staff who've created a problem. They are
but it's not necessarily about
professional standard.
It's also about how the other person feels receiving that care. It's not NHS. This is a private place. Peter Tatchell, always good to talk to you. Thank you very much, Director of the Peter Tatchell Foundation, and Debbie Hayton. Thank you very much, Debbie. Really good to talk to you as well. And I've got to say, and thank you very much for coming into the studio to talk to me as well, Teresa. And how are you now? Are you feeling a bit better, or what's your?
Well, I'm not great, but there's been a lot of support, and HCA have been pressured into offering me another option. So.
Lovely. Well, Teresa, thank you so much for coming in. We appreciate your thoughts and your views. Now, a spokesperson for the Princess Grace Hospital, which is now investigating Teresa's case, said, for reasons of confidentiality, we are unable to comment on individual patients. Our goal is always to provide the best possible care in a safe environment, and we try to accommodate patient requests where we safely can. In some circumstances, we may need to cancel or postpone a procedure if there is not enough time to discuss a patient request ahead of their admission. And in those circumstances, we would always try and reschedule their care after we've been able to fully discuss their needs and how we can safely accommodate them. Well, let's have a quick look at what you've been saying. And it says, if that means no one will be judged by their gender, then it's very much to be hoped. If it means all facilities of whatever type will be open to anyone of whatever sex, then it sounds like a nightmare that should not be allowed to happen. Phil says, and I asked about gender neutrality, what your views were. Phil says, the country is now filling up with people who don't value girls and women at all. Albert says, no, individuality is our key personality trait. Erasing gender is part of blending us into an undefined collective of zombies. Collectivism is cancer. Interesting stuff. Keep your thoughts coming on whether gender neutrality is the way forward. I'm Nana